India's situation is dire. The shortages are crippling, the numbers devastating. India sets a daily world record on new infections. 1 out of 3 new infections worldwide is from India, 1 out of 3. Nearly 1 out of 4 deaths worldwide is also from India. How did we end up here? How did the pandemic in India get out of control? Did the government not pay heed to warnings? Did systemic lapses cause the crisis, or do we blame the unpredictability of this virus? We expected a second surge, yes, but not of this magnitude. If you've been tracking the pandemic in India, you would know this. In February, India was reporting less than 10,000 cases in a day. New cases had dropped to a 9-month low. Health Minister Dr. Harshvardhan had said, and I'm quoting, India was in the end game of the pandemic. Now, for 9 days in a row, 9 days, India has been reporting more than 300,000 new cases every day. So did the government of India declare victory too soon? Did experts predict such a surge? No, they did not. Did we make it worse with mass super spreader events? Yes, we did. Could we have been better prepared? Of course, we could and should have been. Governments, both at the centre and the state level, missed some obvious red flags. The first one came 6 months ago. That should have been enough time to prepare. 6 months. India first discovered the double mutant in October 2020. 6 months ago. This is the variant that is said to be driving India's second surge. Earlier this month, the double mutant was found in 61% of the samples in Maharashtra, the state that is the biggest hotspot in India right now. 61% of the cases were of the double mutant. It has become a variant of global concern. It has spread to at least 17 countries. The latest case has been found in France. Now, when a new variant is found, it basically means that the virus is changing shape in order to keep spreading among people. When India found this new variant, the double mutant, in October 2020, it should have got its guard up. But the warnings were ignored, which brings me to red flag number 2. A government committee had raised an alarm last month. It is called the National COVID-19 Supermodel Committee. What does it do? This committee basically predicts how the virus will behave in the future. And they do this by extrapolating the available data. And here is what they predicted in the beginning of March. The head of its panel spoke to an Indian newspaper. He said that by the 8th and 9th of March, it was clear that India was witnessing a second wave, especially in states like Maharashtra, Kerala and Chhattisgarh. And at this point, governments across the board should have acted urgently. They should have expanded their capacities. Instead, they went in the opposite direction, which is the third lapse we're going to talk about. Dedicated Wuhan virus facilities and oxygen-supported beds were reduced. Going by one estimate, they fell by 6% between December 2020 and April 2021. Even the proposal to add more oxygen plants was caught in a bureaucratic tangle. In October last year, the government of India invited tenders to set up 162 new oxygen plants around the country. 162. They even sanctioned money for this project. But then it moved slowly. By April, only 33 of these plants had been installed. The target was to set up 162, remember. The gap has resulted in a crisis. Lives are being lost due to oxygen shortage. When the situation spiraled out of control, the system swung into action. 59 new plants were to be installed by the end of this month, which is today, end of this month. We're trying to verify how many have been set up. And as per the new target, 80 more oxygen plants will be added by May. Number 4, vaccination. India began the drive in January this year. It has been 4 months. The standalone numbers are very good. India is vaccinating a lot of people. The numbers are among the highest in the world. But if you look at the big picture, India has not been able to cover even 10% of its population. And I know this is a huge population, which is why India's vaccination drive should have been much more aggressive. So far, only 2% of Indians have been fully vaccinated. There is enough proof that vaccines bring down the caseload. They reduce the risk of hospitalization and death. Now we hear of more young people ending up in hospital because they've not got a shot. Let me show you one statistic. In the southern state of Karnataka, 30% of the people who died due to the Wuhan virus had no comorbidity. They did not suffer from any serious ailments or pre-existing conditions. They were healthy individuals. A vaccine could have been a lifesaver for them. So to sum up, India is as much a victim of lapses as an unpredictable and deadly virus. Unfortunately, hindsight can only give us lessons for the future, not undo the death and devastation of the past. WION is now available in your country. Download the app now and get all the news on the move.